Hello and welcome to the Victory Education Lounge. I'm your host, Maurice. Today we're delving deeper into our comprehensive series on malaria. We're at part 5, where we cast our focus on the global impact of this deadly disease. We'll be pulling back the curtain on key statistics and spotlighting the regions that bear the brunt of malaria's heavy blow. It's a crucial conversation, and we're glad you're here to be part of it. If our series has been enlightening for you so far, why not give this video a thumbs up? And while you're at it, hit subscribe and ring that notification bell. That way you won't miss out on any updates from us. We're always keen to hear your thoughts and experiences on this topic, so feel free to drop a comment below and join the discussion. Now, without further ado, let's dive in. Now we start by looking at the numbers. Malaria, an unyielding adversary in our global health landscape, continues to claim a staggering number of lives each year. According to the World Health Organization, there are approximately 229 million cases of malaria globally each year. What's even more alarming is that this ruthless disease snuffs out the lives of more than 400,000 people annually. The most heartbreaking aspect of these numbers is that children under 5 bear the brunt of the disease. About 67% of these deaths occur in this age group, underscoring the urgent need for more effective prevention and treatment strategies, particularly in developing countries. So, where is malaria most prevalent? The disease primarily thrives in tropical and subtropical regions. These areas offer the perfect conditions for mosquitoes, the primary carriers of the malaria parasite, to breed. If we were to map the global impact of malaria, Africa would be the most prominently marked region. Over 90% of global cases stem from Africa, highlighting the tremendous burden this disease places on the continent. But let's not forget that malaria is a global issue. It reaches far beyond the borders of Africa to Southeast Asia, Latin America, and the Middle East. Each of these regions faces its own unique challenges in combating the disease, from limited healthcare infrastructure to resistance to treatment. As we delve into these numbers, it becomes clear that the fight against malaria is not a one-size-fits-all battle. While some regions have made significant strides in controlling the disease, others are still locked in an uphill struggle. The numbers remain alarmingly high, underscoring the urgent need for continued global efforts to combat this deadly disease. Let's take a closer look at the regions most affected by malaria. It's no secret that Sub-Saharan Africa bears the heaviest malaria burden. This region, with its tropical climate and high mosquito population, is in a constant battle against this devastating disease. Several countries here are particularly hard hit, including Nigeria, the Democratic Republic of the Congo, Mozambique, and Uganda. In fact, Nigeria alone accounts for nearly a quarter of all malaria cases worldwide. But why is Sub-Saharan Africa so affected? The reasons are multifaceted. Poverty plays a significant role, as it often limits access to preventative measures like bed nets and insecticides. Inadequate healthcare infrastructure is another challenge, with many remote areas lacking the resources to diagnose and treat the disease effectively. Moreover, resistance to treatment in some areas further complicates matters. Some strains of malaria have developed resistance to commonly used drugs, making treatment more difficult and less effective. Poverty, inadequate healthcare infrastructure, and resistance to treatment in some areas make controlling malaria extremely challenging. While Southeast Asia doesn't see the same volume of cases as Africa, malaria is still a serious concern. In this part of the world, countries like India, Myanmar, and Indonesia are grappling with the disease. India, despite its significant strides in recent years, continues to be a malaria hotspot. While the country has seen a substantial decrease in cases, malaria still thrives in rural and tribal areas. Similarly, Myanmar and Indonesia, with their lush tropical landscapes, are ideal breeding grounds for the mosquitoes that carry the malaria parasite. Efforts are underway to combat the disease, but the battle is uphill. The lack of access to proper healthcare, combined with socioeconomic factors, make it challenging to control the spread of malaria in these regions. In Myanmar, for instance, ongoing internal conflicts have disrupted healthcare services, making it difficult to implement effective malaria control strategies. On the other side of the Pacific, Latin America is also wrestling with malaria. Countries like Brazil, Colombia, and Venezuela bear the brunt of the disease in this region. Brazil has made significant progress in reducing the number of malaria cases thanks to improved healthcare systems and robust mosquito control programs. Yet the fight against malaria is far from over. Colombia, with its diverse ecosystems, faces challenges in controlling the disease, particularly in its remote and rural areas. Despite these hurdles, the country has made substantial progress, reducing malaria incidents by around 50% over the last 2 decades. However, the situation in Venezuela is quite different. Once a shining example of malaria control, Venezuela is now seeing a resurgence of the disease. The political and economic crises have crippled the country's healthcare system, making it difficult to manage malaria outbreaks. As a result, Venezuela has experienced an alarming increase in malaria cases in recent years. So, while Southeast Asia and Latin America are making strides in their fight against malaria, it's clear that the battle is far from over. Each region, with its unique set of challenges, underscores the importance of tailored strategies in combating this deadly disease. The political and economic crises in Venezuela have made it difficult to manage malaria outbreaks, leading to a resurgence in cases. Countries such as Afghanistan, Pakistan, and Yemen also face significant challenges with malaria. Indeed, the Middle East and South Asia are regions grappling with the persistent threat of malaria. In countries like Afghanistan and Pakistan, political instability and ongoing conflict often disrupt healthcare services, hindering efforts to control and eliminate the disease. This has led to higher transmission rates and a growing number of malaria cases. Yemen, being one of the poorest countries in the Middle East, also struggles with malaria. The ongoing civil war has devastated the country's healthcare system, leaving millions without access to essential health services. This lack of access, combined with a favorable climate for mosquito breeding, means that malaria continues to be a significant health concern. Moving further east in South Asia, countries like India and Bangladesh are also battling malaria outbreaks. While significant progress has been made in recent years, the disease remains a major public health concern, particularly in rural and tribal areas, where healthcare infrastructure is less developed. Now, let's turn our attention to Oceania. This region, which includes countries like Papua New Guinea, Solomon Islands, and Vanuatu, is no stranger to malaria. The tropical climate and the presence of many remote, hard-to-reach communities provide a conducive environment for the spread of the disease. Papua New Guinea, in particular, has one of the highest malaria rates in the world. The country's limited healthcare services struggle to cope with the disease, making it a persistent health issue. But despite these challenges, there's still hope. Global health organizations are working tirelessly in these regions, implementing various strategies to control malaria. These include distributing insecticide-treated nets, promoting indoor residual spraying, and improving access to diagnostic testing and effective malaria treatment. The road to eradicating malaria may be long and fraught with challenges, but with concerted effort and international cooperation, it's a goal that's within our reach. Global health organizations are working to bring down the case numbers through consistent mosquito control measures. So while the fight against malaria continues, remember that every small step counts towards a malaria-free world. Beyond the sheer number of cases and deaths, malaria has a massive impact on the healthcare systems and economies of affected regions. Let's consider the strain that malaria places on health systems. In regions heavily affected by the disease, such as Sub-Saharan Africa, Southeast Asia, and Latin America, malaria can account for a significant proportion of hospital admissions and outpatient visits. This high demand for medical attention often overwhelms already fragile health systems, diverting resources away from other vital health services. But the impact doesn't stop there. Health workers in these regions often face increased workloads and emotional stress, dealing with the high number of cases and the devastating loss of life, especially among young children. This can lead to burnout and a decrease in the overall quality of healthcare services available. Now let's turn our attention to the economic burden of malaria. The disease can have devastating effects on a region's productivity. When adults fall ill with malaria, they often miss work, reducing their income and their ability to provide for their families. For children who contract the disease, the impacts can be long-term. Malaria can cause cognitive impairments that affect a child's ability to learn, potentially reducing their future earning capacity and contributing to cycles of poverty. Moreover, malaria also discourages investment in tourism in affected regions. Who would want to invest in or visit a region where the risk of contracting a potentially deadly disease is high? This further impedes economic development and growth. In short, the effects of malaria go far beyond the immediate health impacts. The disease places a significant burden on health systems and economies, exacerbating poverty and holding back development in affected regions. So, while the battle against malaria is undoubtedly a health issue, it's also an economic one. It's a fight for development, for prosperity, and ultimately, for a better future for millions of people around the world. Before we wrap up, I want to emphasize that while we've covered a lot of ground today, there's still so much to learn about malaria. This video is just the beginning of our journey to understand and combat this disease. In the coming weeks, we'll continue to dive deeper into each aspect of malaria, from its life cycle to the latest research in vaccine development. Thank you for joining me today in the Victory Education Lounge. If you're passionate about making a difference, I invite you to support the fight against malaria by visiting United to Beat Malaria. You'll find the link in the description below. Together, we can help save lives and create a healthier world. Every contribution, no matter how small, brings us one step closer to a world free from malaria. Remember to like, subscribe, and share your thoughts in the comments. Together, we can unveil the truths about malaria and join the battle to end this global menace. Disclaimer voiceover. Disclaimer: the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition.